Hi, I'm Tom Ockler, and thanks for coming to YouTube to see my newest video on core muscle activation. I'm going to tell you a little bit about my theories on core muscle activation, and they may be a little different from what you've heard in the past. But instead of thinking of the core muscles as beginning at the respiratory diaphragm and ending at the pelvic diaphragm and then wrapping around you, I'm going to introduce the concept to you. And I go into this in great length in my M2 and my M4 course, that the core actually begins with the operculum and ends with the pelvic diaphragm. So it begins up here at the diaphragm up above the lungs and then ends at the diaphragm and the pelvic floor. And this changes the dynamic of how we do core muscle activation, because you require, in this case, to be able to create great negative pressure in the thorax, because if you can't create great negative pressure in the thorax, you can't have great positive pressure in the abdominal area, and vice versa. So using something as simple as a 2-pound yoga ball and a blood pressure cuff right here, which most people have in their clinics, I'm going to introduce to you a couple of concepts that you can do with the patient while they may be resting on electric stim or doing some other little exercises that allows them to really begin using their core muscles. Now, I'll just push this out of the way for a second. And something that you can practice on your own is if you put your hands on your belly and you take a very, very deep breath, you want to get an idea, are you actually moving your chest or are you letting the belly pop out? Many of us breathe by going, and they let our bellies pop out, and that's really a very inefficient way to breathe. The proper way to breathe is to use the core muscles, and as you do so, you expand your ribs like someone's opening up an umbrella. So as you take that deep breath, the ribs raise up very nicely like an umbrella, and then you let go and the elastic recoil brings it back down. But if you let your belly pop out, you're not going to get as great a filling up here. So we train people, we try to get them to think about pulling their belly buttons in, and you can do this in supine or seated or standing, and just have them put their hands on their belly and say, now don't push into your hands. Keep your hands right there. Draw the belly button in and take a very deep breath. And as you exhale, make sure that they do this through pursed lips, because if they blow out too much carbon dioxide, they're going to become hypocapnic, and they'll get dizzy after only 1 or 2 repetitions. So it's done very slowly and very purposefully. So you can do this, as I say, in standing or seated or supine. It's actually easier in sitting than supine, and even easier in standing. So I'm going to stand up a minute here and do the same thing. Instead of breathing by letting my belly go in and out, I'm going to draw the belly in, get really, really tall, because your transverse abdominal muscle is your basic deep core muscle. So you get nice and tall with that muscle and take a nice deep breath, and then purse the lips. And if the patient is able to do that, they can engage that core muscle. It's a little bit more difficult when you sit, because now, depending on how much intra-abdominal fat and the size of their belly and everything like that they have, the legs are now pushing up a little bit, and there's not so much room to displace it. But again, you can usually still get a good contraction of breathing by drawing the abdominal muscles in, which is opposite from the way most of us breathe, especially as we get older, and definitely opposite from a lot of things that have been taught in certain yoga classes, not all yoga classes, but certain yoga and meditation classes. And this just completely is the opposite, where you draw the belly button in, take that big, deep chest breath, and then let it all recoil out on you just like that, all right? Now, we can also do this in supine, even though it's more difficult to do it in supine. So what I'm going to lay down and take this yoga ball and show you how I'm going to do this before we move on to our next little section. So here I go. I'm going to lie down on the bed, and I'm going to place the ball right on my belly button, and I'm going to draw the belly button in, and then I'm going to take that very deep breath. Now I'm trying to keep the ball as still as possible, and what's going to happen is, if we're used to using our rectus abdominis as opposed to our deep abdominal core, this will happen. and the ball will start to move. And if the person's very deconditioned and they have a very large abdomen, when they take that deep breath, the ball is just going to roll right off. And this is why it's so nice to have one of these things, because it's a good key indicator to the patient that they're doing it correctly. That ball stays as silent as possible, and they've learned to take very deep breaths without disturbing the ball. Just doing this alone while the patient maybe is resting on an electric stim or a laser pad or something of that nature is very, very educational. It helps them to train that deep abdominal core muscle so the ball doesn't move or moves as little as possible while they're taking very big, deep, expansive breaths into the chest. Now, in the next section, I'm going to show you how to use the blood pressure cuff to further strengthen it and give good feedback to the patient when they're moving into that next phase of deep abdominal core breathing.